Hello everyone, welcome to my YouTube channel. Today I am going to cover regarding Plaster of Paris and plaster technique. Before we start, there is the disclaimer. This video is for informative purposes only. I am advising you to refer to the main textbook or sources that is used in each teaching center respectively. Thank you. Now let's begin. What is Plaster of Paris, POP? The Plaster of Paris bandage consists of a roll of muslin stiffened by dextrose or starch and impregnated with the hemihydrate of calcium sulfate. When water is added, the calcium sulfate takes up its water of crystallization. Based on the formula down below, when POP, Plaster of Paris and water is mixed, then heat is released exothermically during the setting of POP. Hemihydrate calcium sulfate, POP, with water will change to hydrated calcium sulfate, gypsum. There are varieties of Plaster of Paris. A. Slab. Only a part of circumference of a limb is incorporated. B. Cast. It encircles the whole circumference of the limb. C. Spica. D. Brace. Regarding Plaster of Paris, what is the setting time and the drying time of Plaster of Paris? A. Setting time is the time taken to convert from powder form to crystalline form. Average time for setting time is around 3 to 10 minutes. The setting time is reduced by 1. Increased temperature of water during dipping. 2. Adding salt into the solution of water. 3. Adding borax into the solution. 4. Addition of resin. The setting time is increased by 1. Low temperature of water. 2. Adding sugar into the solution. We can conclude that the setting time is 3 times longer at 5 degrees Celsius rather than at 50 degrees Celsius. The movement of plaster while it is setting will cause cross weakening of Plaster of Paris. What is B? Drying time of Plaster of Paris. Drying time is a time taken for Plaster of Paris to convert from crystalline form to anhydrous form. The drying time is influenced by ambient temperature and humidity. Optimum strength is achieved when it is completely dry. The average drying time is around 24 to 72 hours. What is the orthopedic uses of cast? A. To support the bone fracture, controlling movement of fragments, and resting the damaged tissues. B. To stabilize and rest the joints in the case of ligamentous injury. Example, in patient post-motor vehicle accident with knee dislocation, whereby patient might have a multi-ligamentous injury. C. To support and immobilize joints and limb post-operatively until healing of the fracture has occurred. Example, in a patient who has comminuted patella fracture, post-tension band wiring or circlage wire. D. To correct a deformity. Example, in the clubfoot condition, clubfoot is congenital talipes equinovarus CTEV correction by using the Ponseti method. What is the advantage of Plaster of Paris? It is actually quite cheap. It's more cost effective, easily molded into a different form. The disadvantage of Plaster of Paris that it is radio opaque. It may obscure the fracture line. It is heavy, easily breaks when come into contact with water. What is the alternative to Plaster of Paris? we can use fiberglass as an alternative. The advantage of fiberglass is that it is lighter, 3 times stronger than the plaster of Paris, impervious to water, that means it's resistant or impenetrable to water, radiolucent, whereby better X-ray view of the bone affected. The problem or disadvantages of fiberglass include that it is costly, less pliable, that means not really helpful in molding, and we need to use glove during application of fiberglass to prevent irritation or itchiness of the hand. Materials that needed to be prepared before the procedure of application of plaster of Paris include plaster of Paris bandage, crepe bandage or roll gauze for application of slabs, a casting glove, a basin of water, whereby the water should be tepid or lukewarm, with either temperature between 22 degrees Celsius and 25 degrees Celsius. Padding, either using a soft band or simple cotton, and bandage scissors. Application of padding is important to prevent pressure sores. Always pad with extra padding, especially at the area of bony prominence. In upper limb, especially at the medial and lateral epicondyles, the olecranon, area of radial and ulnar styloid. For lower limb, important to pad area of iliac crest and sacrum, especially in hip spica application. Pad the head of fibula and neck of fibula to protect the common perineal nerve from injury and the bilateral malleolus. What are the rules of application of plaster of Paris cast? 1. Padding. This is placed from the distal to proximal with 50% overlap. A minimum of 2 layers and extra padding at the area of bony prominence. 2. Plaster usage. We must use the correct size of the roll. 8-inch width for the thigh, 6-inch width for the leg, 4-inch width for the arm and forearm. 3. Molded with palm and not with fingers to avoid indentation. 4. Joint should be immobilized in a functional position. 5. Make sure it is not too tight or too loose with adequate padding. If it is too tight, there is risk of compartment syndrome. If it is too loose, there is a risk of inadequate stability that lead to fracture displacement. 6. Dip the plaster of Paris vertically in water until air bubble cease to be present. 7. Uniform thickness of plaster is preferred, with an idea that the plaster of Paris should last for the whole period of treatment. So how do you know whether the application of plaster of Paris is adequate or acceptable, especially in distal radius fracture? Then we can use a cast index. So what is cast index, CI? It is a ratio of anterior-posterior AP to lateral internal diameters of the cast at the fracture site. It is an objective measurement. Again, it is calculated by measuring the internal anterior-posterior AP diameter of the cast excluding padding at the level of fracture and dividing it by the internal lateral diameter of the cast excluding the padding. Both measurements are made by using the first proper radiograph taken after close reduction, and the calculation results in a numerical ratio. Chess et al. Describe an ideal CI index, cast index, is at 0.7 at distal radius based on anthropomorphic studies. CI index more than 0.8 correlates with risk of fracture redisplacement. What are the errors involved in applying a padded plaster? 1. Attempting to plaster at the same time as attempting to hold a precise reduction. 2. Applying wool carelessly in shapeless lumps. 3. Loose bandaging. 4. Risk of developing a Wellington boot effect, especially in application of below-knee plaster of Paris. What are the complications involved in plaster of Paris application? If it is due to a tight cast, patient can have pain and swelling at the affected limb, pressure sore, compartment syndrome, peripheral nerve injury, example, common peroneal nerve injury. If it is due to plaster of Paris allergy, patient will develop allergic dermatitis. Benzalkonium chloride is the allergen responsible for plaster of Paris induced allergic contact dermatitis. If it is due to improper application, patient will develop joint stiffness, example, at the wrist, the elbow or ankle joint stiffness. Blisters and sores that will lead to infection, especially in a diabetes mellitus patient. Breakage, loss of function of plaster of Paris whereby the fracture could be displaced. Other complication, example is deep vein thrombosis, DVT, especially in patient who has risk factor, example in patient who is in hypercoagulable state. So what do you advise to patient regarding plaster of Paris? So you can advise, avoid getting the cast wet. Use plastic bag to cover the cast while bathing. Do not step or walk on the cast, whereby the cast will be ruined and lost its purpose or function. Elevate the affected limb at home with pillow to prevent increase in swelling. Do not stick anything inside the plaster of Paris to scratch due to itchiness. This may lead to injury, either formation of blister and infection. Example, formation of abscess. If severe, they develop necrotizing fasciitis. Instruct patient to return to the hospital as soon as possible if there is increase in pain, numbness, or impact sensation, where patient have sign and symptom of compartment syndrome. Please advise patient, do not wait until the fingers or toes become blue or black. Okay everyone, that's all for today. I hope you have learned something from this video. Till we meet again, see you, bye.